Hey guys, it's Dr. Giles here with Aspire Chiropractic. Do you get headaches and neck pain and upper back pain? And do you get pain right here between your shoulder blades? You might be dealing with something called upper cross syndrome. We talked about lower cross syndrome a couple weeks ago, and this week we're going to talk about upper cross syndrome. And you can imagine, yes, it is in the upper part of the body. Let's talk about the muscles that are involved. Now, there's a number of muscles, but there's just a few that are really the main ones that we want to focus on. We've got our chest muscles, which are our pecs. We've got our upper trap muscles, and we've got a nasty, pesky muscle called the levator. All right? These muscles are all our tight, or what we might say, overactive muscles. Now, we also have the lower traps, our rhomboid muscles, and then some muscles called the deep cervical flexors or the deep neck flexors. And these are our weak muscles. Or we might say they're inhibited. Now, just like in lower cross syndrome, upper cross syndrome there's an imbalance between these muscles. So you can see that this creates a cross pattern. It's like a tug of war between the muscles, where those tight muscles are pulling and rounding your shoulders forward, your neck is going forward, your head is jutting out, it's creating a hump in the back, and these weak muscles are getting strained and tense. It leads to pain in between the shoulder blades, severe and chronic headaches, constant nagging neck pain, and it can even contribute to things like numbness, tingling, aching, burning that you might experience in that area. It looks as well like poor posture, like we see in this picture. See how this gentleman here has already got his head jutting forward. He's developing that hump in his back. Now, what can you do about this? Well, first of all, overall, what we want to focus on is we want to start to soften these tight muscles. That means stretching them, massaging them, self-myofascial. Might even use some stuff in the office that we have like Soft Wave that helps treat soft tissue like that. And with the weak muscles, we want to activate those and strengthen them. We want to be doing exercises that engage these muscles to help relieve some of that tension that's being pulled on them. And most importantly, you want to see your chiropractor, because all of these muscles are innervated by nerves. They come out of the spine. And there's nobody better to deal with the nerves coming out of the spine or any issues with it than the chiropractor. It's what we deal with all day, and it's what we deal with best. So if you've been having chronic headaches, you're getting that nagging shoulder pain, if you're getting severe, sharp pain in the neck, and you're thinking maybe it's got something to do with upper cross syndrome because you're sitting at a computer desk or you're sitting at your phone and you start to notice that hump on your back, well, you know where to go. Aspire Chiropractic here in DFW. We're ready to help you when you're ready to be your best, naturally.